Bismillahirrahmanirrahim. Our today's topic is 6 rights of drug safety, and this lecture is intended for MIT second year for the subject of pharmacology. Well, here, if we see the topic, here are the more emphasis we will put on drug safety, and these 6 rights are to ensure that the drug is administered safely to the patients. So for that, we need to discuss the process, how the drugs are administered, and how the drug process, how the drug reaches to the patient from the pen of the doctor to the administration, nurse, technician, or the pharmacist. So what is the basic principle, or what is the basic procedure? It is a prescription. In order to understand what are 6 rights and how safely drugs can be administered to the patient, we must need to study a bit about prescription. So what is a prescription? Prescription is a set of, if we define prescription, it is a set of specific directions issued by a medical practitioner to a pharmacist or a nurse or a technician for the appropriate use of a medication or medications in a particular patient. So 2 more important things in this definition are a set of specific directions. So these directions are not generalized. These are specific. Why specific? Because every individual patient is prescribed differently. So the set of information, the set of directions is specific according to the disease, according to the age, according to the gender, and many other factors. A clinician or a medical practitioner takes under consideration. So that is a particular patient with the same disease. For example, there are 2 patients with the same disease, might not be same. There might be comorbidities which must be taken under consideration. So basically, prescription becomes an individualized plan of care to remedy a medical problem. So medical problem could be same in many patients, but to remedy it, we need an individualized plan. We cannot go as a generalized plan with the generalized plan. So what form a prescription can take? Prescription can be communicated either verbally, in writing form, or transmitted electronically. So anything that comes out of a medical practitioner in any form, whether on a written on a paper, on a verbal note, or transmitted through a text message, telephone, or whatever form it may take, but still it will be called as a prescription. So is it the case that always the drugs are prescribed, or any other things can also be the part of prescription? Yes, prescription can also contain medical equipment. For example, the use of nebulizer, the spacer, if an asthmatic patient is there and the doctor prescribes him or her an inhaler, and inhaler is administered with the help of a spacer, and he must mention, or he might mention about the spacer as well. So that will be medical equipment. Or the services are, for example, diagnostic tests or clinical referrals, might be the relevant clinical specialist or specialist physician is called upon. And diagnostic tests, for example, there are many diagnostic tests. For example, if some patient goes to a doctor with unspecified infection, the doctor may think that it is necessary to prescribe him about CBC, a complete blood count, urinalysis, ESR, or anything, monitoring of the blood pressure, whatever he thinks are suitable for that particular patient. So again, that is an individual plan of care to remedy a medical problem for a particular patient. Well, in this slide, what do you notice the first? So there are many strengths of a medicine are written, and the route of administration is written, form of medicine is written, for example, tablet, then SR, TD, BD, daily, TD. There are many other instructions. So these are the instructions. For example, if you take these two examples, 500 mg oral tablet BD after food, while here it is 500 mg oral tablet SR. So if you compare these two, this one and this one, so the strength of the tablet is same. Because it is a tablet, it is also a tablet. It is same. The route is same. But what is different? Here the strength is same, but the variant of the drug is different. It is SR. That is means sustained release. But here it is the normal one. So that is an individualized care. And this is BD. Bis and die. BD means bis and die means twice a day, morning and evening. But this tablet is only prescribed for evening. So these particulars are quite similar but very different, entirely different. If some patient takes this takes the wrong drug, he was supposed to take this and instead he took this, or he was administered this, then there might not be the same consequences which must be produced with these. Well, here is a typical prescription which we have seen all our lives. Here is what does this prescription contains. This contains the name of the center, then the contact number of the centers, the address of the center, then there is the name of the prescriber, license, that is very much important, of the prescriber, then the name of the patient, then the date. Why date is important? Date is very much important because this is refill. There is, encircle this, there are no refills for this. So from the date, and why date is important, again we come back here. The drug itself is written, which drug he has prescribed. It is clarithromycin, 500 mg. How many? 20. And what is the dose frequency? This is the total number of drugs or total number of tablets the patient is supposed to take. And what would be the frequency? That is BID. BID I told you twice a day. And if he takes 20 tablets twice a day, it means these will end in 10 days. For 10 days he will take. So if this date differs, then it might affect the refill. The patient might be prolonged. So that's an electronic medication order. Well, Then we see the components of a prescription. What are different parts? If you see this prescription again, here if we break down this prescription in different components, what are those components? Number one, prescriber information. Here it is. Patient information, name, then age would be there, date, symbol of subscription, that is R, and medication prescribed, here which medicine has been prescribed, then dispensing direction, how the pharmacist or the nurse or the technician will dispense that drug. For example, that is for 10 days. How many? 20. And there is no refill. These are, then there are milligrams, which tablet. So these are the dispensing directions. Then the directions for patient, how many tablets he has to take. Then the prescriber's signature. Without signature, no document is valid. So as prescription. And this is an example of radiologic investigation. For example, this is a consultant, accident and emergency department. So he has been there is a head injury, and he might be prescribed anything out of these. So what is the medication order? What are the types of prescription? Medication order, there are two types of patient. Number one, outdoor patients, and number two, indoor patients. Outdoor patients are those patients who are coming to the hospital and get their examination done, take a prescription, and go away to the pharmacy, take their medicine at home. These are outdoor patients. Then we have indoor patients. Indoor patients are admitted in different wards in a hospital. For them, the prescription is written, that is called medication order. Here are different types of medication orders. We don't have to go into details. So now we come back to 6 rights of safe drug administration. Why do we need safe drug administration, and what are those 6 rights? Number one, the right patient, the right medication, the right dose at the right time, the right location or the route, the right documentation. These are the 6 rights of drug safety. So coming back to this prescription, for example, if this would have been a medication order and the clarithromycin 500 mg BID for 10 days, to whom? Wesley Thomas is the patient who will receive that drug. But if, for example, if they might have written Mr. Thomas to the bedside, on the side of the bed there is an identification sheet which identifies the patient. So for example, they might have written Mr. Thomas with the last name, and there is another patient in the same ward with the name of Johnson Thomas. That was the Wesley Thomas, or the other patient might be Johnson Thomas or only the Thomas. He would have been written as Mr. Thomas as well. The patient 1, the patient A, the correct patient, is at bed number 6, for example. And the wrong patient, which was just the Johnson Thomas or the Thomas, who was also written as Mr. Thomas, he was at bed number 1. So once the drug is prepared and ready for administration, there might be a chance of mistake. which Thomas would get this drug. There is a chance that might. So that is why the right patient is required, right medication, the clarithromycin. There are many drugs which sound alike. The doctor on duty, the nurse on duty, the pharmacist on duty, or the technician on duty might confuse one drug for another and might administer the wrong drug. Right dose, 500 mg BD. So there are drugs which exist in many forms, many strengths. A same drug, for example, if I give you an example of Augmentin. So Augmentin is available in the market as 375 milligram tablet and 625 milligram tablet and 1000 mg or 1000 milligram tablet as well. So if the patient is prescribed 625 mg twice a day for 7 days, but the wrongfully or by mistake the patient was dispensed 1000 mg tablet and was instructed to take 2 tablets a day, but original dose of that particular patient was 625 twice a day, almost 375 mg exceeds per dose, and 750 mg per day, and in 7 days how many milligrams in addition that patient will take, you can imagine. So why we need safe drug administration, why we need to have all the things right, because of drug safety. We already know the drugs are chemicals and drugs can produce many side effects, adverse effects. Side effects and adverse drug reactions differentiate themselves if within the therapeutic range an undesired effect occurs, that is called a side effect. So if, for example, the right dose, I gave you an example of excessive dose, but for example, if a patient is prescribed 1000 mg BD Augmentin, but he was dispensed 375 mg by mistake, then he will be short of dose or the drug. The required plasma level will not be maintained and drug may not produce the desired effect. So that is an example of underdosing. The first one, the example of overdosing. So the right dose was 1000 mg twice a day, but 375 milligram twice a day collectively won't make 1000 mg in a day, rather than making 2000 mg. So the right time is very crucial, because in many cases in hospital admitted patients we may need to maintain the drug or plasma drug level. If dosing is not done appropriately on time, this might affect the plasma drug concentration to fall below the optimum level. So the time is very much important. So here are some possible explanations. Right patient. How can we ascertain or make sure that the patient is right? Ask the patient their first and last name. does the order match the patient? You have to see that. First and last name. I gave an example of Mr. Thomas. The first one was Wesley Thomas, and the second one was Johnson Thomas. And if you only write Mr. Thomas, then it may produce confusion. So you have to confirm the first and the last name, because many patients can have the same names, same last names or same first names. So we can differentiate from asking both the names. If a slightest of the doubt is there, just ask again. Then there is a right medication. Does the label of the medication matches the order? Be vigilant with look alike and sound alike medications. You will see in a few seconds. Right dose. Dose is very much important. I told you just on the previous slide. So you have to ascertain, you have to make sure that does the strength and dosage match the order? Is it half, whole, or multiple tablets? For example, there are many tablets which are available in one strength, say 1000 mg only, but the dose required by the patient is 500 mg. So what is the solution? You don't give 1000 mg to him, you just half that tablet. Simple. Or 1000 mg means that the whole, or 2 tablets of 1000 mg. Then the right time. Does the administration time match the order? Before administering a PRN medication, ensure specified time interval. What is a PRN? I have added notes to it. You can. So right route. Does the route match the order? Can this be crushed or mixed in other substances? Have any transdermal patches been removed? So here many tablets, for example, we just saw an example here, 500 mg tablet SR, 500 mg tablet BD. So SR is sustained release. So most of the time SR or sustained release tablets cannot be crushed. So many tablets cannot be crushed, or many substances, many drugs cannot be mixed into other substances. So this is called a compatibility order. So you must check the compatibility. Then write documentation. If the nurse or the pharmacist, anyone who has administered the drug but has not written on the order that the dose has been given, there might be a chance of duplication. So right patient is when we say that it is the right patient, because when administering a drug, it must be certain that the patient receiving the drug is the patient for whom the drug has been ordered. This is accomplished by checking the patient's wristband containing the patient's name or bedside identification paper. So in some instances, the patient is directly asked to identify himself as what is your full name. However, the question should not be asked as, are you Mr. Johns? Some patients, particularly those who are confused or have difficulty hearing, may respond by answering yes, even though that is not their name. Or okay, then we have right drug. Drug names are often confused, especially when the names sound similar or the spellings are similar. Nurses who hurriedly prepare a drug for administration or who fail to look up questionable drugs are at increased risk of administering the wrong drug. We may have seen many people do the assigned task very fastly. They have a habit. They hurriedly do everything, virtually everything, and there are many people who do very slowly, thoughtfully. So, as far as the medication administration is concerned, it is a very, very risky procedure. You must not overlook any possibility. Here are the examples of drugs that are easily confused. For example, there is Kador or Imdor, Inderol, Isordil, Flomax or Fosamax, Urex and Cirex. Then we have Zocor and Zoloft, Zyvox and Vioxx. These all are different drugs like nifedipine and nicardipine, prednisolone, prednisone. Here is specific prednisolone and prednisone, Prilosec and Prozac, Retrovir and Ritonavir. So these are the drugs that may be confused by a nurse or pharmacist or a technician. So must be looked or double checked whether the drug which has been written is it the same or different. So I had a chance to deal with a real case scenario that occurred in a pharmacy where I used to work. There came a doctor to have a anxiolytic. Anxiolytic means a drug which removes anxiety. That is called Dormicum. But instead, the salesperson dispensed him a diamicron, or pharmacy assistant. So here you can see diamicron and Dormicum sound alike. So this is an oral hypoglycemic drug, means that is used for diabetes, and for diabetes means it lowers the blood glucose level. So what happened? The patient was suffering from anxiety, but he was given a diamicron and he took 2 tablets of diamicron and was verge of death because her blood sugar level dropped to a critical level. Although she survived with the blessing of Allah, but otherwise it might have been a big consequence. So always double check. So write dose, route and time. So all this information must be obtained with the primary care provider's written order for the administration of all drugs. What is the right dose? What is the route? What is the time? So dose and time will define the frequency. Dosage form. What is the dosage form? It should be given in a syrup form, a tablet form, injection. Dosage form will describe the route. For example, if it is an injectable, then we would use a parenteral. The dosage to be administered 500 mg, 1000 mg, and the frequency once a day, twice a day, thrice a day, 4 times a day. How many times? If the order is unclear, don't assume that it would be like this, because usually that is a dose, usually that is a frequency. Why you don't have to assume? Because this is an individual plan of care for the remedy of a medical disease for a particular patient. So it might be different for many patients. So Unclear order may include unclear directions for the administration of the drug, that at what time it must be administered, or here the frequency, dosage form, that might be unclear. Illegible writing. The writing, we are familiar that the writing of the physicians sometimes is illegible, might not be able to read out what's written in that. That might also cause confusion. So always ask question if you cannot read that. A drug dose that is higher or lower than the dosages given in approved references. For example, he might have written a wrong dose. You must check for this right. Then the last point is right documentation. After the administration of any drug, records of drug administration should be processed immediately. That stress is on immediately. Don't push it aside, because you might forget, or if you forget, the dose could be doubled. So immediate documentation is particularly important when drugs are given on an as needed basis. That is called PRN drug. So what are those? For example, in case of pain, in the morning the patient had pain and he was prescribed pain relievers when to subside the pain, but in the evening he might not have pain. So for example, most analgesics are pain relieving drugs, required 20 to 30 minutes before the drug begins to relieve pain. A patient may forget that he or she has received a drug for pain, may not have been told that he has administered. So medication documentation, how we can make it right right documentation. First, make sure you have the right chart. That is the game. If you have someone else's chart and you wrote that drug, that I have administered this drug to that patient, that will be a wrong. That won't be a right documentation. Never chart a drug before it is administered. So sometimes many technicians, many the people who are administering the drug, they do what? They have a common practice. They gather all the charts, write all the medications which they are going to administer. So they start off writing all the drugs, they dispatch those charts to their respective beds, then they start administering the drug turn by turn. But what happens sometimes, in between there is an emergency, they have a call, they go away in between the administration of the drug, and they ask to supervise, or they ask to carry out that plan by someone else, and that might create a confusion. So never chart a drug before it is administered. So documenting includes name of the drug, dosage, route and time. If you have written only one parameter like drug, no dose, no route, no time is there, then it is not a right documentation. It might confuse others, because in hospitals the work is done in shifts, morning, evening and night. So all the shifts take an over from the previous shift. So if you have not written the time, that might confuse the next shift personnel who is going to administer the dose that might not have been administered. He might double the dose, or he might not administer the dose at all. So record location when giving parenteral medications. Parenteral medications, we have already studied that intravenous, intramuscular, subcutaneous. So by which route out of parenteral, by which location the drug has been administered. Follow agency policy if a medication was not given. For example, if that was skipped, so what how and where the remedy will be done. Document client's or patient's response to the medication. For example, he had pain and you administered a drug, and after 20 to 30 minutes you check the response. You ask the patient, are you feeling comfortable now, or is there any percentage of relief in your pain? Then you can document that as well. What it will do, this will help in deciding the physician who will come to the round afterwards. For example, the physician comes to the round at 8 a.m. in the morning, and he prescribes or he orders all the medication until the next day when he will visit again at a.m. In between, how the patient was managed will be seen by the doctor or by the physician the next day. And whose responsibility is that? I already told you that the shift is finished, morning shift is finished, then the evening is there, then the night is there. If the night duty personnel didn't document that the patient was comfortable with that medicine, or she recorded that the patient there was no relief by the drug, the doctor might change that drug. Or she recorded that there was a big relief by the drug, the doctor will carry on that and will plan out that how many days further he has to his drug. Then you have to remember the 5 W's when documenting medication administration on chart. It is when, why, include assessment, symptoms, complaints, and labs. What, medication dose route. Where, it is a site, and was, medication was tolerated, it was helpful to the patient or not. So all this discussion, how it will be bridged in your subject, that is radiography or imaging techniques, because we talk in a generalized form which might not be relevant to you, but how this can be bridged, all this knowledge can be bridged to your subject, that is medical imaging technology. So in imaging techniques we have many scans, like many for example, a PET scan. What is a PET scan? What is an MRI? Then there are, here you can see a SPECT scan. What are these? I have added all these examples here. So for example, we will take an example of PET scan. So what is a PET scan? PET scan, what does the PET stand for? It stands for positron emission tomography. And here if you see it, what is the relevance to the pharmacology perspective? What is the relevance with this topic? The drug, disease, food interaction, dose of insulin, diabetic patient, glycemic control, anxiety. So what is, for these, to understand these examples, we must undergo, we must study, or we must understand the principle of PET scan. So what actually this is, it is a type of imaging technology, the PET scan. It is used to evaluate how your tissues and organ work at cellular level. So before moving to that, if you remember through your physiology knowledge, if we talk about the metabolism of the body, the respiration, the cellular respiration, how does this occur? Number one, you inhale oxygen which is carried into your blood, and that is transported by the RBCs, and those RBCs carry that oxygen to the tissue cells, and that oxygen goes into your cell, and cells carry that oxygen inside their cell membrane by simple diffusion, and then cells also take up glucose with the help of insulin. Insulin helps in uptake of glucose within the cell. So within the cell, now we have oxygen and glucose. They react chemically and produce energy. Simple as that. So PET scan actually sees this. How efficiently, if a cell, if there is no problem with the cell, if there is no disease to the cell will function properly. Cell would definitely take a proper glucose uptake, and oxygen uptake will be proper. So this technique, or the PET scan, actually sees how efficiently our tissues and cells are working. So how does we see that? It involves the injection of a short-acting radioactive substance that is known as radiotracer, which is absorbed by biologically active cells. So see, any disease cell will have a different absorptive capability. So biologically active cell will absorb an appropriate amount of radiotracer. Then you or the patient is placed in a tunnel-like device that actually identifies, or that is able to detect and translate the emitted radiation into three-dimensional images by identifying abnormalities in the metabolism of a cell. If there is an abnormality in the metabolism of a cell, that will definitely be radiated out. So what a PET scan can do, it can diagnose, assess the severity of a wide range of diseases including cancer, heart diseases, and disorders of the brain. But most of the time in Pakistan specifically, PET scan is being utilized in cancer hospitals. Shaukat Khanam and Inmol are conducting. What could be the purpose of the test? There could be different types of PET scans, and the radio tracers all work. For example, if we talk about a radio tracer, cancer cells multiply rapidly and do not undergo programmed cell death like normal cells. They will absorb more radio tracer in the course of metabolizing sugar. So more radio tracer will be gone into the cells, and it will emit more radiations that will be highlighted by the PET scan. So these are different types of radio tracers used here. These are different diseases, different cancers, for which cancer is being diagnosed. Here is a cardiac diseases. Then now risks and contraindication. So radio tracer is essentially glucose with a radioactive isotope attached. For example, a glucose molecule is combined with a radioactive isotope. Radioactive isotope you might have a knowledge from your chemistry. Isotopes, there are different numbers of neutrons, and radioactive means which can emit rays. So the drug half-life is extremely short. So some agents have a half-life as short as 2 minutes. So for example, if there is a patient who was injected with radio tracer, he might be anxious. Before this radio tracer or radioactive tracer is being delivered by the IV route, there might be anxiety. For example, the patient knows that this test will tell him or her that the stage of cancer or the diagnose the cancer. He might not be aware that he has a cancer, but this test will determine that he has a cancer. He must be anxious. That is quite obvious. So a lorazepam drug is given which might have an interaction with the radio tracer, or the radio tracer if there is a diabetic patient. So you see, I have explained that this radio tracer is a glucose molecule combined with a radioactive isotope. If there is a diabetic patient who has missed his or her insulin, then this will what will happen? This will reduce the uptake of glucose into the cell and give false results. So being a technician, being an MIT medical imaging technician, you must ascertain, you must make sure that the patient has taken a right dose of insulin before giving him a right dose of a radio tracer. Second example could be of MRI. For example, MRI is magnetic resonance imaging. So plenty of water, or you might need to have a contrast agent to help images appear. You must be knowing this better than me. Lie on a table outside of a scanner, then this is the procedure of hold. So we are concerned with this. Here is a drip, here is an infusion. The contrast injection might be injected. Then here are different drugs that are used in an MRI. For example, this is MRI without gadolinium. Gadolinium is a drug, or that is a contrast medium that is being used in an MRI. So for example, it is with gadolinium, it is without gadolinium. So active disease based on lesions that light up. So there again, this is the gadolinium magnivist. Here is the dose calculation in ml, patient weight. So again, right patient, right dose. If the weight of the patient is 66 to 70, and 90 ml of the gadolinium should be administered. If the weight of the patient is greater than 100, then 150 ml. So again, right patient, right dose, right administration, right time. If the test has to be conducted at 12 o'clock and you ask the patient to come at 6 and inject him, this will be the wrong time. Before the drug is uptaken just before 3 hours. And the dose must be ascertained that the right patient has been injected the right dose. Here is again the comparison of different contrast agents. Dose, here you see EOVest is a brand name that has a different dose. if this EOS, that is 0.025, is administered in 0.1 millimole per kg. Here is the dose. If you calculated that according to all these are, by the way, are the same drugs, gadolinium, under different brand names. If you remember the nomenclature of the drugs, the brand names and the generic, their generic or their non-proprietary name is the same, but their brand names are different. So here they have modified this drug and very little quantity is required. So for example, there is a patient, for example, if the weight of the patient is 2 kg, then you can calculate the dose of Garavest 0.1 millimole per kg, multiplied with 2 and multiplied with 2. The dose would be different. If someone injected or administered this dose to that patient for EOS, then it would be the wrong. You can see the effect of dose. Here is another aspect. What are medication or drug errors? What will happen if you do not follow these 6 rights? Then this is called a medication error. It is simply a deviation of a medication dose from the physician's order or prescription. It is administration of a wrong medication, dose, diagnosis, or to a wrong patient. Simply, you followed all 5 rights on a wrong patient. Everything goes wrong. The patient was right, the dose was wrong, documentation would be wrong, everything goes wrong. So it also includes a failure to administer prescribed medication at a time specified or in a manner it is prescribed. So drug errors can be defined as any occurrence that can cause a patient to receive the wrong dose, the wrong drug, an incorrect dosage of the drug, a drug by the wrong route, or a drug given at the incorrect time. So here are some web resources. You can take quizzes, and I'll give you the assignments as well. I'm just waiting for the summer vacation. Then the take-home message for you guys specifically: always adhere to 6 rights to make sure the drugs are safely administered to avoid medication errors for the well-being of the patients. It is not your well-being only or the reputation of the laboratory you will be working for. It will be the well-being for the patient as well. If the patient will be underdosed with a radio tracer or with a substance that will actually trace, then it might misdiagnose a disease and it might affect a whole family, not just an individual. So be sure that everything is right. Thank you very much. See you next lecture, inshallah.